Sexual health experts say there are essential recommendations for a successful sexual relationship between spouses, the most important of which is the exchange of love, affection, and honesty. Without these feelings, the sexual relationship cannot succeed. Even if the sexual relationship is strong and successful at the beginning of the marriage, it will collapse and fade if it is not based on love, understanding, and affection. Age. It is also important to understand that age is not a primary factor in enjoying this instinct that God placed in humankind. However, every age has its limits. News reports indicate that a 90-year-old man underwent surgery to have a penile implant to help him achieve an erection because he still felt that sex was important in his life. The question of whether women's libido decreases after the age of 40 or after menopause is frequently asked. Here, menopause refers to the end of the ability to conceive and bear children, not the end of the ability to enjoy sex. The definitive answer is that both husbands and wives retain their sexual desire well into old age, albeit at a gradually decreasing rate with age. Studies indicate that a significant percentage of women report experiencing their first orgasm during intercourse, sometimes referred to as a post-menopausal orgasm. These studies suggest this is due to the woman's feeling that the fear of pregnancy has subsided. Exercise. Studies agree that exercise for both genders and all ages is one of the most important factors in maintaining sexual potency, including erectile function and libido. When we say exercise, we mean any type of physical activity that you enjoy. Kegel exercises and others. There are studies recommending specific types of exercise to improve sexual desire and potency, which are gaining significant attention from both men and women. The most popular of these exercises are Kegel exercises, which strengthen the pelvic floor muscles in both men and women, thus improving erections and stimulating sexual function. You can find information about these exercises through search engines like Google, and we'll see some examples here. Other exercises include planks, squats, and yoga. Proper nutrition and vitamins are also important. This is a lengthy topic, and I think we can all agree that proper nutrition is fundamental to a better life. What concerns me here is avoiding anything that leads to obesity. All studies indicate that obesity in both men and women negatively impacts sexual desire and potency. There are also claims, which may be true, that certain foods help improve sexual potency and desire, such as seafood, nuts, especially walnuts, almonds, and cashew nuts, and fruits, especially bananas, watermelon, berries, and ginkgo biloba. Many studies confirm that vitamin and mineral deficiencies can lead to sexual weakness, particularly vitamin D, vitamin B12, and zinc. Male and female hormones. This is where the role of a specialist in men's and women's sexual health comes in. In a previous article, I mentioned that the male hormone testosterone gradually declines with age, so we may need to monitor its levels in the blood periodically. Testosterone levels may be within normal ranges, but some men may need to increase them to improve sexual performance. This also applies to women. They should consult a gynecologist if they feel their libido is decreasing. The female hormones estrogen, testosterone, and other hormones, especially thyroid hormones, play a crucial role in maturation and sexual desire in women. Stress and premature ejaculation. Studies show that stress or fear of erectile dysfunction or premature ejaculation, and dwellin. What is sexual intercourse? Sexual intercourse is the reproductive relationship between a married couple, in which the male penis is inserted into the female reproductive system. If intercourse is successful, sperm is transferred from the male's body to the female's, and fertilization of the female's egg can occur, potentially resulting in pregnancy. Sexual intercourse between a married couple involves 4 phases, known as the sexual response cycle. These phases include the arousal phase. This phase can last from a few minutes to several hours. During this phase, several bodily changes occur, including increased muscle tension, increased heart rate, increased respiratory rate, redness and flushing of the skin, increased nipple erection, erection of the penis. Vaginal lubrication may begin. The woman's breasts become fuller, and the vaginal walls begin to swell. The man's testicles swell, the scrotum constricts, and it begins to secrete lubricating fluid. Not all of the above symptoms occur in every couple, and they may vary each time. One partner may experience a decrease in libido at times. The arousal phase, this is the phase of sexual foreplay between the couple, which helps increase sexual arousal. In this phase, the changes that began in the first phase intensify, and these changes include: the vagina continues to swell due to increased blood flow, and the vaginal walls may become darker than usual. The woman's clitoris becomes more sensitive. Respiration, heart rate, and blood pressure continue to increase. Muscle cramps may begin in the feet, face, and hands. Muscle tension increases. The orgasmic phase, this is the peak of the sexual response cycle. It is the shortest phase and usually lasts only a few seconds. Common characteristics of this phase include: involuntary muscle contractions begin. Blood pressure, heart rate, and respiration reach their highest levels. The leg muscles cramp. The vaginal muscles contract in women, and vaginal spas. In reality, there is no specific time limit for intercourse between spouses. The ideal duration is whatever suits both partners, and it depends on several factors, including age. In youth, intercourse can last longer, but with age, it may become shorter. Hormonal changes affect the sexual health of both men and women. Presence of a health problem. Suffering from a health problem can affect the duration of intercourse, especially sexual conditions such as premature ejaculation or delayed ejaculation. The relationship between the spouses. The marital relationship affects the duration of intercourse in several ways. Intercourse may occur without foreplay due to a lack of understanding between partners, or a lack of communication between the spouses to clarify each other's needs during intimacy. Pain during intercourse. Pain during intercourse is a problem that both men and women may face, affecting the duration of intercourse. The stages of intercourse may not be completed due to the pain experienced by one or both partners. For more information, what is the ideal duration of intercourse? Benefits of intercourse. There are many benefits that couples gain from engaging in intercourse. The benefits of sexual intercourse include: boosting the immune system. Sexual activity helps improve the immune system of both partners, along with other immune-boosting practices such as a healthy diet and adequate sleep. Improving libido. Regular sexual activity contributes to improved libido and helps maintain healthy sexual desire. For example, intercourse increases vaginal lubrication and blood flow in women, which can enhance their desire for intimacy. Preventing pelvic floor muscle spasms. Sex exercises and strengthens the pelvic floor muscles, improving bladder control and preventing urinary incontinence in women. Enhancing physical fitness. Sex is a full-body workout. During intercourse, approximately 5 calories are burned per minute. Reducing the risk of heart attack.